This short training video will take you through the steps of planning a total hip replacement in Materialise Orthoview. Having opened the patient study, the first step is to select the required procedure for the patient. In this case, we are planning a total hip on the patient's right side. Once the procedure is added, the software will then move on to the next step, scaling, in this case using the marker to calibrate the image. If there is a marker present on the X-ray, Orthoview will automatically detect it and prompt the user to indicate its size. In this case, we are working with a marker with a size of 25 millimeters. After calibrating the image, the software automatically moves to the appropriate step for the chosen procedure. On the left-hand side of the screen, you will see a number of tools or wizards. The purpose of these wizards is to allow the user to mark and measure key points on the patient's anatomy. The software can then use this information to do some initial sizing and positioning of the implants. In this workflow, we will use the unilateral Smart Hip Wizard, which was specifically designed for planning on a full pelvis X-ray, as you see here. After turning on the wizard, we can move its elements around independently by using the control points. Using these controls, drag the circle so that the outline of the circle matches the outline of the patient's femoral head. This allows us to measure the diameter of the head, as well as its position. The second part of the wizard is the transitional line, used for measuring leg length difference. Typically, this is placed so that the two central points are on the base of the pelvis at the ischium, and the 2 points on each side are placed on matching points on the lesser trochanter. Once the wizard is correctly positioned, we can click on the Position Template button. This will bring us automatically to the next step, which is templating. Here, the software will use the reference points and measurements taken with the planning wizards to do some initial positioning of the implants on the image, and also highlight some suggested sizing. On the left-hand side of the screen, we can see the choice of template along with the sizes and different options. The software will use colors to highlight various aspects of those panels, as follows. The dark blue highlighted number is the suggested best fit size, based on the measurements taken with the planning wizards. The software also highlights in a lighter blue color one size more and one size less than that suggested value. To change the implant choice, click on the graphical banner for the implant you want to change. This will then display your list of available implants from which you can select. You can then begin to set and change the sizes and values for your implants to find the correct sizing for the patient. Only once all the values have been fully selected by the user will the template outline change to a darker, bold color. To move a template, place the mouse anywhere inside the outline of the implant, then hold down the left-hand mouse button and drag. Holding down the right-hand mouse button and dragging allows the implant to be rotated. If a template, such as the femoral stem, has an axis line running through its center, when you left-click to move the template, it will only move along that fixed axis. To move the templates in any direction, look for the main control point in the center of the template. Place the mouse directly on this point and use the left mouse button for free, unrestricted movement. As you continue to reposition and resize the templates, you will see in the top left-hand corner of the screen real-time feedback regarding changes in leg length, offset, and cup inclination angle. Once you are happy with the final positioning and sizing of the template, you can then complete the plan. If desired, use the Reduce button in the top left-hand side of the screen to see a reduced view of your implant positioning. There are 3 choices at the top right of the screen for storing your plan: Save, Commit, and Close. Save will store the plan and allow for modifications later on. Commit will save the plan as final and upload it back to the PACS system. Close will just close the plan without keeping any information. After committing, the software will also store a full report apart from the template image. This report can be viewed by clicking the Report button at the top left-hand side of the screen. There is also an option on the main toolbar to allow selected portions of this report to be displayed on the main X-ray view. For additional hints and tips relating to every stage of the planning process, use the Smart Help tab located on the right-hand side of the screen when using the software.